a specialized fogging system that disperses a fine mist of disinfectant throughout the entire vehicle.
So it's not just about wiping things down in those situations.
No, sometimes a more comprehensive approach to ensure that all potential pathogens have been eliminated. It's about minimizing the risk of transmission to subsequent patients and healthcare providers.
It sounds like there's a lot to consider when it comes to ambulance cleaning and disinfection. It's a multifaceted process that requires a systematic approach, attention to commitment to following those established protocols.
Well said. It's not a task to be taken lightly, but it's a crucial part of maintaining a safe and healthy environment for everyone involved.
Well, we've covered a lot of ground in this deep dive. We've explored the hazards of hazardous materials, delved into the world of infectious diseases, and even ventured into the often overlooked but crucial realm of ambulance cleaning and disinfection.
It's been a whirlwind tour of knowledge.
It has. And hopefully our listener now feels better equipped to handle a hazardous materials incident, make informed decisions to protect themselves and others from infectious diseases, appreciate the importance of those unsung heroes who keep those ambulances sparkling clean.
Knowledge is power, and I hope this deep dive has empowered our listener to make informed choices for their health and safety.
Absolutely. But remember, this is just a starting point. There's a vast universe of information out there about these topics. So keep learning, keep asking questions, and stay curious.
And as we wrap up this deep dive, here's a final for you to ponder. Considering the increasing threat of antibiotic-resistant organisms, what actions can individuals and communities take to help slow down their spread?
That's a great question to leave our listener with. It challenges us to think about how our everyday actions can impact the bigger picture of public health.
Thanks for joining us on this deep dive. We hope you've enjoyed exploring these important topics with us.
Stay safe, stay informed, and keep learning. Welcome back, everybody, for another deep dive. This time we are going to be tackling a really important topic. It's one that unfortunately is pretty common: abuse and behavioral emergencies. And we've got a couple of chapters here, some dense medical textbook chapters we're going to get through.
You know, I think what's interesting about these chapters
Yeah.
is that they really go beyond just define. They really try to explain
Yeah.
sort of the why behind these issues
Yeah.
and how they manifest in real life situations, which I think can be really helpful for anyone, not just someone in the medical field.
Yeah, definitely. And so when we think about abuse, I think a lot of times people immediately, their mind jumps to like,
Yeah.
but the reality is it comes in so many forms, and these chapters really emphasize that. Emotional abuse, sexual abuse, and neglect,
Yeah.
which I think sometimes can fly under the radar.
Yeah, yeah. And even when we talk about neglect, it's not always as straightforward as, with shelter. The chapters highlight this concept of passive neglect, which is really interesting, where, a giver may not be intentionally harming a child, but their inactions, are creating a dangerous environment. So, things like substance abuse by the caregiver, or even consistently failing to provide, emotional support and can have a profound impact on a child's well-being.
Yeah, it's heartbreaking to think about, and it makes me think about how vulnerable kids are, especially younger children. The chapter actually mentions that younger children are at a much higher risk for abuse and neglect.
Yeah, that's right. And I think it's a stark reminder that abuse can happen anywhere, to anyone. It crosses all socioeconomic boundaries, all communities. This isn't something that only happens over there.
Exactly, and it kind of brings us to this idea of recognizing the warning signs. And I know,
Right.
for medical, a whole mnemonic, child abuse, to help them remember the red flags.
Yeah, it's a really helpful tool for them. But I think what's important for everyone to understand is that context is key. So, for example, one of the elements of that mnemonic is delay in seeking care. Now, sometimes that's a legitimate red flag. But imagine a single parent, 2 jobs, who can't afford to miss work or doesn't have access to reliable transportation. Suddenly, that delay doesn't seem quite so suspicious.
That's a really good point. Yeah, it really highlights how to look at the whole picture and not just jump to conclusions based on one isolated factor.
Exactly. And we're on the topic of recognizing abuse. We can't forget about our senior citizens. Elder abuse is sadly on the rise, and it often presents unique challenges.
Yeah, I imagine it's even harder to detect because the signs might be different than with child abuse.
Precisely. An older adult might be more reluctant to report abuse because they're afraid of being placed in a nursing home or worried about getting their caregiver in trouble, especially a family member. And then you have to factor in things like potential cognitive decline, which can make it even harder to identify what's happening.
Yeah, definitely. So we talked about kind of these different phases. Let's shift gears a little bit and dive into the world of behavioral emergencies. And I think it's important to remember that not every instance of unusual behavior is an emergency.
Right. We're really talking about situations where someone's behavior poses a clear and present danger or others. So think of someone who's become suicidal or homicidal or is experiencing a psychotic episode where they've lost touch with reality. Those are the kinds of situations that require immediate intervention.
Okay, so the chapters break down sort of the potential causes of abnormal behavior into 4 main categories. We've got factors, environmental factors, acute injury or illness, and substance-related issues.
Yeah, and what I find so fascinating here is how interconnected the mind and body are. These chapters really emphasize that physical illness can impact behavior and vice versa. It's really a holistic view. That challenges the idea, we can treat mental and physical health as separate entities.
Yeah, absolutely. And it makes me wonder, professionals evaluate these situations. The chapter mentions this mnemonic COAST map, which sounds pretty intense.
Yeah, so it stands for consciousness, orientation,
Yeah.
activity, speech, memory, affect, and mood.
Oh.
And perception. So by systematically assessing each of these areas, medical professionals can get a clearer picture of what's going on with the person. So for example, if someone is disoriented to time and place, or their speech is, rapid, it can indicate a more serious issue.
But it's not just about observing the behavior itself, but understanding the context and looking for these additional signs.
Exactly. Now let's talk about some common behavioral that we might even encounter in our own lives. Things like anxiety disorders, phobias, and panic disorder. These are surprisingly prevalent in our society.
Someone who suffers from panic attacks, and it's really debilitating for them, they describe it as this: sudden, intense fear that just comes out of nowhere with physical symptoms like a racing heart, difficulty breathing. It sounds terrifying.
It absolutely can be. Yeah, it's more common than you might think. The chapter highlights a startling fact. Women are 67% more likely to be affected by panic disorder than men.
Wow, that's a huge difference. What do you think contributes to that? Is it biological? Societal?
Yeah.
A combination of factors.
It's a great question. And while the chapter doesn't delve into the specific reasons for this gender disparity, it does point at the importance of understanding how various factors, biological, environmental, and social, can contribute to the development of anxiety disorders. It's not always a simple answer.
Right.
It's often a complex interplay of things.
Yeah, definitely. So we've covered a lot of ground here, talking about, use, behavioral emergencies. And the thing is, a lot of these things overlap and influence each other.
Absolutely. It's all interconnected.
It is. But I think it's important for us to tease these things apart and try to understand them as best we can.
I agree. The more we understand, the better equipped we are to recognize these issues.
Yeah.
And potentially help ourselves or others.
Absolutely. We're going to wrap up part 1 of this deep dive. We'll be back soon with part 2, where we'll continue exploring these topics in more depth. So stay tuned, and we'll see you then.
And speaking of anxiety disorders, it's important to understand. Post-traumatic stress disorder, or PTSD, it's a severe form of anxiety that can develop after someone experiences a traumatic event.
Like what kind of events are we talking about?
Well, the chapter mentions things like military combat, terrorist attacks, car accidents, sexual assault. Essentially, any of a person's ability to cope can be a trigger for PTSD.
That makes sense. And I've heard that people with PTSD often relive the trauma through flashbacks and nightmares.
That's right. And those flashbacks can be so vivid and intense that the person feels like they're right in that traumatic moment. It can make it incredibly difficult to move on and live a normal life.
So what can be done to help people who are struggling with PTSD?
Well, the chapter emphasizes the importance of creating a safe and supportive environment. So that can mean therapy, support group, or even just having understanding friends and family. We're willing to listen without judgment.
Yeah, it sounds like feeling safe and supported is crucial for healing.
Dangers that paramedics and healthcare workers face when dealing with
potentially patients. It's a stark reminder that these professions aren't just physically demanding; they can be incredibly dangerous.
Yeah, that's something I hadn't really considered before. What kind of situations are particularly? Well, the chapter specifically mentions domestic violence calls as being among the most dangerous. Your emotions are running high, and there's often a history of violence between the individuals involved.
It's not just about providing medical care, it's about assessing the situation and ensuring everyone's safety, including their own.
Exactly. And the chapter goes on to outline some factors to be aware of. Things like whether alcohol or drugs are involved, the presence of crowds, or if there's already evidence of violence at the scene.
I imagine those factors can escalate a situation quickly.
They absolutely can. The chapter also points out, certain individuals who are more likely to become violent, such as people who are intoxicated, experiencing drug withdrawal, or dealing with psychosis or delirium.
Okay, so let's say someone finds themselves in a situation, maybe a paramedic, maybe just a bystander, a potentially violent patient. What are some things they can do to de-escalate the situation?
Well, the chapter really emphasizes the importance of verbal de-escalation techniques. So trying to calm the person down, speaking in a calm and reassuring voice, and validating their feelings sometimes make a huge difference.
That makes sense. But I imagine there are also times when talking just is enough.
You're right. The chapter is very clear on that point. It stresses the importance of knowing when to and call for backup. There's no shame in prioritizing your own safety. And sometimes removing yourself from a volatile situation is the best course of action.
So it's about recognizing the warning signs, using verbal de-escalation when possible, and knowing when to disengage and get help.
Precisely. And it's important to remember that. Paramedics, for example, are generally not supposed to physically restrain patients unless absolutely necessary for safety. Restraint should always be a last resort.
That's really interesting. I never realized how much goes into handling these kinds of situations. It's not just about medical knowledge. It's about understanding human behavior, risk assessment, and de-escalation techniques.
It really is a complex and multifaceted. And these chapters. Just scratch the surface of what's involved in responding to abuse and behavioral emergencies.
It's amazing how much we've learned just from these 2 chapters. We've covered so much ground, from the different types of abuse and their warning signs to the complexities of emergencies and the dangers first responders face.
And it's all knowledge that can be valuable to anyone, not just those in the medical field. Understanding these issues can help us be more informed, more compassionate, and potentially even save lives.
It's been a really eye-opening deep dive. I feel like I'm walking away with a much better understanding of these issues, and it makes me think about how I can apply this knowledge in my own.
I think that's exactly the point. It's not just about absorbing the information. It's about how we use that information to make a positive impact, even in small ways.
So true. Okay, so let's do a quick recap of the key takeaways for our listeners. We learned that abuse isn't always physical. It can be emotional, sexual, which can be both active and passive. We also talked about how crucial it is to recognize warning signs of abuse, especially when it comes to vulnerable populations, like children and the elderly.
And we explored, the
Yeah.
complexities of behavioral emergencies, understanding that they're not just about abnormal behavior, but situations where someone's actions pose a threat to themselves or others. We touched on the interconnectedness of mental and physical health, the importance of recognizing those risk factors for violence, and the techniques professionals use to de-escalate those potentially dangerous situations.
Wow, that is a lot. But it's incredibly valuable knowledge, and it can empower us to be more aware, more compassionate, and potentially even intervene in a helpful way if we encounter these situations in our own lives.
And that brings me to a final thought I want to leave our listeners with. Well, we've covered a lot of ground today. Remember, this is just the tip of the iceberg. There's always more to learn and explore when it comes to these complex issues.
Absolutely. So here's a question for everyone to ponder. How might this knowledge shift your perception of everyday interactions? Could it empower you to help someone in need, or even just approach challenging situations with more empathy and understanding?
It's something to reflect on. Sometimes just being aware can make a world of difference.
Well, that wraps up our deep dive into the world of abuse and behavioral emergencies. Thanks for joining us on this journey. It's been a privilege to learn alongside you.
Until next time, stay safe and keep those minds open. All right, diving in again today, the endocrine system.
Oh, a fascinating one.
Yeah, I'm excited for this one. We've got some dense medical textbook excerpts here.
Oh, excellent.
Luckily, our listeners are already pretty into this stuff.
Right, they're not starting zero, that's for sure.
So we can really get into the nitty-gritty. We're going to focus on endocrine emergencies.
When hormones go haywire?
Exactly. Those moments when things go seriously wrong.
It's a bit like, knowing warning lights on your car dashboard.
Oh, I like that.
You don't have to be a mechanic.
Right.
But understanding what means trouble can save you a major breakdown.
Absolutely.
Yeah.
Okay, before we get to the warning lights, though, let's just back up for a second.
Sure.
Endocrine glands versus exocrine glands. Difference again?
So endocrine glands release hormones directly into the bloodstream.
Got it.
And those hormones affect things all over the body, whereas exocrine glands, they use ducts to send substances outside the body.
Yeah.
Like sweat or saliva.
So it's all about where those secretions end up.
Exactly.
Inside or outside?
Inside or outside.
Okay. The source had this great mnemonic, exocrine equals XIT.
That's a good one.
Super helpful, right?
Yeah.
So those endocrine hormones,
Yes.
they're like what, tiny messengers?
They're traveling through your blood, delivering instructions to different cells.
So how do they know which cells to talk to?
Well, imagine that each cell has a specific set of locks,
Okay.
and only certain hormones have the matching keys.
Interesting.
These are called receptors.
Okay.
And when a hormone binds to its receptor,
Yeah.
it triggers a specific action within that cell.
Makes sense. So what happens if the message gets scrambled? Or, a cell gets the wrong instructions?
Well, that's where those feedback loops come in.
Okay, the feedback loops.
Yeah, think of it like a thermostat.
Okay.
If the temperature gets too high, it signals the AC to turn on, cool things down. Similarly, your body uses positive and negative feedback loops to maintain hormonal balance.
Gotcha. So give me an example of how those loops actually work.
All right, let's take childbirth.
Okay.
As labor begins, the hormone oxytocin stimulates contractions.
Okay.
And those contractions further stretch the cervix, which in turn signals the release of even more oxytocin.
Oh, wow.
So this escalating a positive feedback loop continues until the baby is born.
So it's amplifying the change and specific goal is reached.
Exactly.
What about negative feedback?
So negative feedback is about bringing things back to balance.
Okay.
When you're stressed, your adrenal glands release adrenaline.
Right, getting you ready to fight or flee.
Exactly, prepping you for fight or flight. Once the stress passes, negative feedback kicks in.
Okay.
Lowering adrenaline, bringing your body back to its resting state.
So endocrine emergencies are basically when those feedback loops malfunction,
You got it.
causing hormones to be underproduced.
Exactly.
Okay, and this can happen for a variety of reasons. I mean, we're talking genetic factors, to
Yep.
infections, even certain medications.
Right, it's a whole range of things.
Speaking of control systems, the source calls the hypothalamus and pituitary gland the master glands.
They really are.
Why do they get that title?
Well, the hypothalamus is like the CEO,
Okay,
constantly monitoring your internal environment,
right?
sending out directives.
Okay,
The pituitary gland is like the manager,
got it.
receiving those directives, relaying the orders to other endocrine glands throughout the body.
So they're calling the shots for things like growth,
Absolutely.
stress response, even reproduction.
Exactly. And one of the glands under their command is the thyroid,
Okay, the thyroid.
responsible for regulating your metabolism.
Right, with the hormone thyroxine.
That's it.
And here's where it gets really interesting for, those of us paying attention to what we eat.
Yes.
Thyroxine production requires iodine.
Right.
So what happens if you're not getting enough in your diet?
Well, iodine deficiency can lead to hypothyroidism.
Okay.
Where the thyroid can't produce enough thyroxine, you might experience fatigue, weight gain, even difficulty concentrating.
Wow. So something as simple as not getting enough iodine
Right.
can have this ripple effect throughout the body.
It really can.
Now, the thyroid also produces calcitonin,
Yes.
which manages calcium levels. But there's another set of glands involved there, right?
You're thinking of the parathyroid glands.
Yes, the parathyroid glands.
They release parathyroid hormone, or PTH,
Okay.
which actually increases calcium levels when they dip too low.
Interesting.
It's a delicate dance between these two hormones to keep calcium in that sweet spot.
So even within the endocrine system, we've got these checks and balances going on.
We do, constantly.
What about the adrenals?
Yes.
They seem to be all about that fight or flight response.
They're like your body's rapid response team.
I like that.
The adrenal cortex produces cortisol, essential for managing stress.
Right.
Regulating things like blood pressure, energy use.
Cortisol. We all love to hate.
Exactly.
Then there's the adrenal medulla,
Yes,
which releases adrenaline and noradrenaline,
it does.
giving you that surge of energy and focus when facing a perceived threat.
Exactly.
It's amazing how our bodies prioritize certain functions under stress,
It is, isn't it?
like shutting down digestion to divert energy elsewhere.
Exactly.
It makes you realize how chronic stress can really affect our overall health.
Oh, absolutely.
Now, the last gland we'll touch on today is the pancreas.
Okay,
And it's unique because it has both endocrine and exocrine functions.
that's right. A double.
Right. It's involved in digestion and blood sugar regulation.
Yep.
Can you break it down for us?
So the pancreas releases digestive enzymes through ducts into your small intestine.
Okay.
That's the exocrine part.
Got it.
But it produces insulin and glucagon, two hormones that control blood sugar levels.
Okay, so how do those two work together?
Well, insulin acts like a key, unlocking cells to allow glucose to and be used for energy.
Okay.
When blood sugar rises, say after a meal,
Mm-hmm.
insulin is released to lower it back down.
Okay.
Glucagon does the opposite.
All right.
When blood sugar drops too low, it signals the liver to release stored glucose back into the bloodstream.
It was like a constant balancing act
It is.
to keep those blood sugar levels stable.
Yep,
Our source mentioned that glucagon can only do its job
right.
if the liver has enough glycogen stored up.
That's right.
What happens if it doesn't?
Well, think about that feeling of a sudden energy crash
Oh, yeah.
after a sugary snack, but no real meal.
Right.
You get a quick burst of energy as your blood sugar spikes, but then it plummets
Yeah.
because your body didn't have those long-lasting glycogen reserves to tap into.
Oh, that's happened to me before. It's like your body saying, hey, I need more than just sugar here. Which brings us to diabetes.
Ah, yes.
Can you explain the difference between type 1 and type 2?
In type 1 diabetes, the pancreas doesn't produce insulin at all,
Okay.
often starting in childhood.
Mhm.
It requires lifelong insulin injections to manage blood sugar.
Look.
In type 2, the more common form,
Right.
the body either doesn't make enough insulin or becomes resistant to its effects,
Interesting.
often developing later in life.
And our source mentioned that over 3 million Canadians are living with diabetes,
Wow,
with even higher rates in men.
that's a lot of people.
That's a staggering number, which makes understanding these endocrine emergencies even more crucial.
It does, absolutely.
And one of the most serious is hypoglycemia,
Right, low blood sugar.
where glucose levels drop below 4 millimole. This can happen to anyone, but it's especially dangerous for people with diabetes.
Absolutely, it can be very serious.
Knowing that hypoglycemia can be so serious, what should we be looking out for? Are there any early warning signs that could help us prevent it from reaching that critical stage?
Absolutely. So you might see trembling, rapid heart rate, sweating, and intense hunger.
Okay.
But what's tricky is that these can be mistaken for intoxication.
Oh, wow. So someone might appear drunk when they're actually experiencing a medical emergency.
It's possible, yeah.
That's scary,
It is, which is why quick action is so important.
right?
Treatment for hypoglycemia must be immediate.
The source mentioned a mnemonic, AEIOU tips,
Oh, yes.
to assess altered status, but it didn't explain what those letters stand for. What can you tell us about that?
So AEIOU is a helpful way to remember potential causes of altered mental status. It stands for alcohol, epilepsy, insulin, overdose, uremia,
Uremia.
kidney problems, trauma, infection, psychiatric, and stroke.
Okay.
So remembering this mnemonic, quickly run through potential causes and get help faster.
Okay, so we've talked about low blood sugar.
Right.
What about high blood sugar?
Okay.
What happens then?
So chronically high blood sugar or hyperglycemia can be very dangerous as well.
Okay.
And it can progress to a condition called diabetic
Diabetic ketoacidosis,
or DKA,
DKA.
a potentially life-threatening situation.
DKA. That sounds serious.
It can be.
What's happening in the body when someone has DKA?
Basically, the body isn't getting the glucose it needs for energy
Okay.
because of insulin to allow it into the cells.
Right.
So it starts breaking down fat for fuel instead,
Okay.
producing ketones as a byproduct.
Ketones.
The problem is ketones are acidic,
Ah, I see.
and their buildup in the blood disrupts the body's delicate pH balance.
Our source hyperglycemia is also linked to worse outcomes after a stroke.
It is,
It's a reminder to take even seemingly mild symptoms seriously.
absolutely.
And while we've been focusing on diabetes, there are other endocrine emergencies related to different glands that we should be aware of as well.
There are definitely.
All right, that's a perfect segue into part 2 of our deep dive. We'll be back after a quick word from our sponsors.
Welcome back. So we've laid the groundwork for understanding the endocrine system. Now it's time to explore some specific conditions that can arise when things go wrong.
Right, the emergency.
Exactly. Revisit the thyroid gland, the one responsible for metabolism.
Okay.
We talked about how iodine deficiency can lead to hypothyroidism.
Right.
But what happens when things get really serious? Our source mentions something called myxedema coma.
Myxedema coma. That sounds serious.
It is. It's like at the extreme end of hypothyroidism.
Oh,
A
wow.
life-threatening condition where the body's metabolism slows to a crawl,
Oh, gosh.
impacting multiple organ systems.
So it's not just about feeling tired and sluggish.
No, it's far beyond that.
What kind of triggers can push someone into a myxedema coma?
Well, it can be a perfect storm of factors. Untreated hypothyroidism, exposure to extreme cold, infections, certain medications, even trauma or surgery.
So basically anything that puts significant stress on an already compromised system.
Yeah, exactly.
So what should we be watching for? Are the symptoms dramatically different from regular hypothyroidism?
Well, while fatigue, weight gain, dry skin are common in both. Myxedema coma is characterized by a marked decline in status.
Okay.
You might see confusion, lethargy, even loss of consciousness. There can also be a drop in body temperature and blood pressure.
Wow. So it's a cascade of problems that can quickly become life-threatening. What about the opposite end of the spectrum? When the thyroid is
It's
overactive?
called hyperthyroidism.
Okay.
And in severe cases, it can lead to thyrotoxicosis,
Thyrotoxicosis.
where the body essentially goes into overdrive.
Thyrotoxicosis. That name sounds pretty intense. What's actually happening in the body when someone experiences this? How does it differ from a simple overactive thyroid?
Think of an overactive car engine, revving too high.
Okay, yeah.
Thyrotoxicosis is like that engine redlining, threatening to blow a gasket. It's a state of extreme metabolic acceleration that can lead to heart problems, fever, even delirium.
Okay, so what are the red flags? How would someone know if their overactive thyroid is tipping into dangerous territory?
Well, they might experience a racing heart, unexplained weight loss despite a big appetite, nervousness, tremors, sweating, and insomnia.
Okay.
Basically, everything speeds up and becomes exaggerated.
That sounds pretty exhausting. And our source mentions another scary sounding term, thyroid storm. What exactly is that?
A thyroid storm is a rare but life-threatening complication of hyperthyroidism. Imagine all the symptoms of thyrotoxic, but amplified tenfold. It often comes on suddenly, triggered by things like infections, surgery, or even childbirth.
Oh, wow.
And the symptoms are even more extreme. You might see a very high fever, dangerously fast heart rate, severe agitation and confusion, even seizures.
Okay, so it's a true medical emergency,
It is.
requiring immediate attention. Wow, we're really seeing how delicate this balance is. Too little thyroid hormone can have serious consequences.
Yeah.
Before we move on from the thyroid, what can you tell us about goiters?
So a goiter is simply an enlargement of the thyroid gland,
Okay.
often visible as a swelling in the neck. It can be caused by a variety of things,
Oh, yeah.
from iodine deficiency to inflammation, or even tumors.
So a goiter itself isn't necessarily a problem,
Right,
but it could be a sign of an underlying thyroid issue.
exactly. While many goiters are harmless,
Mhm.
some can cause discomfort or difficulty swallowing if they press on surrounding structures, and
Sure.
others can be associated with either hypothyroidism or hyperthyroidism. So it's always best to get any unusual neck swelling checked out.
Good advice.
Oh,
Okay, let's shift gears and talk about the parathyroid. I remember they regulate calcium,
they do?
but what happens when they malfunction?
Well, if the parathyroid glands become overactive,
Mm-hmm.
they release too much parathyroid hormone, leading to hyperparathyroidism.
And PTH means?
Too much calcium in the blood,
Okay.
which might not sound like a big deal,
Right.
but it can lead to a range of problems: fatigue, weakness, bone pain, kidney stones, heart issues.
That doesn't sound good at all. What about the opposite? Hypoparathyroidism.
That's have too little parathyroid hormone,
Okay.
resulting in low calcium levels in the blood.
Okay, so instead of bones, stones, groans, and moans, we'd see a different set of problems.
Exactly. Calcium can cause muscle cramps and spasms, tingling in the hands and feet, even seizures. It's a completely different set of warning lights to be aware of.
This is also fascinating. It really highlights how interconnected our bodies are
It is.
and how much we rely on these glands to function properly.
Yeah.
Are there conditions related to the parathyroid glands that we should be aware of?
Those are the main ones, but it's important to remember that any disruption in calcium balance can have cascading effects on other systems,
Okay.
like nerve function and muscle contraction.
Right, so even seemingly isolated problems can have wide-reaching consequences.
Exactly.
Well, we've covered a lot of ground on the thyroid and parathyroid glands. What's next on our endocrine adventure?
Let's move on to the adrenal glands,
Okay,
the powerhouses behind our stress response, and so much more.
perfect. We'll be right back to delve into the world of the adrenals. And we're back, ready to tackle those adrenal glands.
The grand finale of our endocrine tour,
They're kind of like the body's first responders, right?
that's a great way to put it, crucial for handling stress.
Yeah.
But they do a lot more than that too.
Right, the cortex makes cortisol.
Yep.
And the medulla pumps adrenaline. We talk about adrenal insufficiency.
Mhm.
When the cortex isn't making enough cortisol, That can be really bad.
It can.
What about the opposite, though? Too much cortisol, or Cushing syndrome.
Cushing syndrome, yeah. It's a fascinating one because it shows just how powerful cortisol effects are all over the body.
So it's involved in blood pressure, metabolism, even the immune system.
All of that, yep. And when there's too much, it throws things way off balance.
What symptoms should make someone think, hang on, maybe this is Cushing's?
One of the most noticeable is weight gain.
Okay.
Particularly around the belly and face.
Okay.
You might also see thinning skin, easy bruising, muscle weakness, high blood pressure. But it's not just physical.
Oh, interesting.
People with Cushing syndrome can have mood swings, get irritable easily, even have trouble concentrating.
Wow, it can really mess with your life.
Yeah.
What causes this overproduction of cortisol in the first place?
Few possibilities. Could be a tumor on the pituitary gland. Remember, that's the manager signaling to the adrenals.
Right.
Or a tumor on the adrenal gland itself. Even long-term use of corticosteroid medications like prednisone can do it.
So if you're experiencing those symptoms, definitely see a doctor.
Absolutely, got to figure out the root cause.
Yeah, the adrenaline part. Can things go wrong there too?
For sure. One that comes to mind is pheochromocytoma.
What now?
Pheochromocytoma. It's a tumor in the adrenal medulla.
Okay, pheochromocytoma. And what's happening in the body with that?
Basically, it's like your fight or flight is stuck on.
Oh, yikes.
The tumor makes the medulla release way too much adrenaline, noradrenaline. So you get these persistent or sometimes sudden surges in blood pressure, rapid heart rate, sweating, headaches, intense anxiety.
Sounds awful. What would even trigger those surges?
It really depends. Some people, it's physical activity.
Oh, wow.
Even certain foods can set it off.
Really?
For others, it might be stress or just changing positions.
Like standing up?
Yeah, things like that. The key is figuring out your triggers and getting treatment.
So we've got adrenal insufficiency on one end, Cushing syndrome, pheochromocytomas on the other. Those adrenal glands walk a tightrope.
They do. And that highlights how important this is for the whole endocrine system. These glands are working constantly to keep us healthy.
It makes you realize we need to take care of them.
We do.
But with all these things that can go wrong, it's a bit overwhelming.
Right.
What are some simple things we can do to support our hormonal health?
Well, the good news is a lot of it overlaps with general health advice.
Okay.
Eating a balanced diet.
Right.
Regular exercise, managing stress, enough sleep, all those impact hormones positively.
It's like a holistic approach, mind and body.
Exactly. And knowledge is power. The more you understand your body, the better decisions you make.
This deep dive has been eye-opening for sure. Learned about how intricate the endocrine system is.
It is.
The problems that can happen, but also ways we can keep things balanced. Any last words for our listeners?
The biggest takeaway, I think, is our bodies are amazingly complex and resilient. Endocrine emergencies are serious, but knowing the signs, getting help quickly, that makes a huge difference. Taking care of yourself, those lifestyle choices can prevent problems in the first place.
Being proactive, in tune with our bodies. Well, thank you for guiding us through this endocrine world. I've learned a ton.
My pleasure. To our listeners, exploring, keep asking questions, keep taking good care of yourselves.
That's all for this episode of The Deep Dive. We'll be back soon with another fascinating topic. Until then, stay curious. Hey, everyone. Ready for a deep dive into something a little intense?
Intense is right.
Yeah, we're going to be talking all about bleeding and shock today.
That's right.
We've got some pretty heavy medical textbook chapters to get through.
But don't break it down.
Yeah, we're going to make it as interesting as possible.
I think people are really going to be surprised by some of this stuff.
I think so too.
Yeah.
Like, I had no idea that losing just 1 liter of blood can already start to cause some serious problems.
Yeah, that's right.
And that kids are even more vulnerable to blood loss just because they have less blood to begin with.
That's exactly right. And that's exactly why we're here.
To help everyone understand.
Yeah, to help everyone understand just how important this is.
Yeah.
Because, knowing how your cardiovascular system reacts to bleeding could honestly save a life.
Yeah, seriously.
And maybe even your own.
So, okay, let's not get ahead of ourselves.
Okay.
Let's start with the basics.
That's it.
How does this whole cardiovascular system actually work?
So think of it like a complex delivery system. Okay.
Your heart is this powerful engine pumping blood through a network of highways.
Okay.
Your blood vessels.
Makes sense.
And the blood itself is like the delivery truck carrying oxygen and nutrients to every single cell in your body.
Okay, that's a good analogy. I like that.
Yeah.
So what happens when this system springs a leak?
Well, the amazing thing is your body is totally prepared for that.
What? Really?
Yeah. It has all these built-in mechanisms to try and compensate for blood loss.
Wow.
So your heart will start pumping.
Okay.
Your blood vessels constrict to maintain pressure.
Okay.
And your body even releases hormones that help retain fluid.
It's like a whole emergency response team.
Exactly.
Just kicks into gear.
That's a great way to put it.
Immediately.
But here's where it gets tricky.
Okay.
These mechanisms, while heroic in the short term,
Okay.
can actually backfire.
If the bleeding isn't controlled.
Exactly. It's like pushing that engine too hard for too long.
Oh.
Eventually it's going to give out.
That makes sense. Yeah. And that's where the trauma triad of death comes in.
Yeah, that sounds pretty ominous. So what exactly is that?
So it's a combination of 3 deadly factors. Hypothermia sets in because the constricted blood vessels aren't delivering enough warmth.
Okay.
Then there's coagulopathy, which is where your blood struggles to clot properly.
Okay.
And finally, the buildup of waste products leads to acidosis.
Acidosis.
Which throws your whole body's chemistry off balance.
Wow. Okay, so it's really a race against time then.
Yeah.
Which is why knowing how to spot bleeding is so important.
Exactly. But our sources mention that it's not always easy, right? Like blood loss can be tough to assess.
Yeah.
Depending on where it's happening.
Oh, absolutely. So with external bleeding, what you see is what you get.
Right.
But bleeding is a whole other story.
Yeah, because you can't see it.
Yeah, it's like a hidden leak.
Right.
And the signs can be much more subtle.
So what should we be looking for?
So think about it this way. If blood is leaking internally, it has to go somewhere right. Yeah, that's true.
So you might see things like vomit that looks like coffee grounds, or very dark tarry stools that's digested blood making its way out.
I see.
Or bright red blood in the stool, which would mean that the bleeding is lower down in the digestive tract.
Okay, that's definitely something you wouldn't want to ignore.
No, not.
But let's go back to external bleeding for a second.
Yeah.
Like, how much blood loss is too much?
Well, the source material mentions that even losing just 1 liter of blood can cause some serious changes in your vital signs.
1 liter?
Yeah, that's about 2 standard soda bottles.
Wow.
Might not seem like a lot.
No.
But remember, your body relies on that blood volume to function properly.
Right, and you mentioned earlier that infants and children are especially vulnerable to blood loss.
Yes.
So why is that?
Well, think about it this way. If adults are like big trucks,
okay,
kids are like little scooters.
Okay.
They just don't have the same carrying capacity.
Makes sense.
They have less blood volume to begin with.
Well,
so even a seemingly small amount of blood loss
can be a big deal.
Can be proportionally much greater for them.
Wow, that puts things into perspective.
Yeah.
So what should we be watching for in children specifically?
It's all about being extra vigilant with kids.
Okay.
Any bleeding that doesn't stop quickly,
Okay.
or any signs of lethargy, confusion, or rapid breathing should be taken seriously.
Got it.
Don't hesitate to seek medical attention if you're at all worried.
Okay, good advice.
Mm-hmm.
So we've talked about bleeding both internal and external.
Right.
Now let's tackle the big one. Shock.
Okay.
What exactly is happening in the body when someone goes into shock?
Think of shock as like a state of collapse.
Right.
It's your cardiovascular system kind of waving the white flag saying it can't keep up anymore.
Oh, wow.
And this can actually happen for a number of reasons.
Like what? What kind of reasons?
So the most common one is called hypovolemic shock.
Okay.
And that's caused by blood or fluid loss.
Okay.
But there's also cardiogenic shock, where the heart itself is failing to pump effectively.
I see.
Then you have neurogenic shock, often caused by spinal cord injuries.
Okay.
Where the body loses its ability to regulate blood vessel constriction.
Wow.
And finally, there's distributive shock, which includes things like anaphylactic shock from severe allergic reactions.
Okay, so a lot of different roads can lead to the same destination.
Exactly. And regardless of the cause, the ultimate consequence is the same: inadequate tissue perfusion.
Okay, and remind me what that means again.
That means your cells aren't getting the oxygen and nutrients they need.
Okay.
And waste products start to build up.
Oh.
It's like a city losing power and sanitation.
Oh, wow.
Things fall apart pretty quickly.
Yeah, I can see that.
Yeah.
So it's not just about blood loss, it's about the entire system kind of breaking down.
Exactly. And this breakdown often happens in stages.
Okay.
The first stage, compensated shock, is like your body trying to put out a small fire.
Okay.
You might see things like restlessness, anxiety, or a rapid heart rate. These are early warning signs that something is wrong.
So those early signs are actually really important.
Oh, they're super important.
Like someone being unusually anxious or restless after an injury.
Exactly. They're your body's way of saying, hey, we need help here.
Wow.
But if the underlying problem isn't addressed, things can progress to decompensated shock.
Okay.
That's when the fire starts to spread.
Oh.
And you see things like a drop in blood pressure, confusion, and labored breathing.
Okay.
And then the final stage, irreversible shock, is when the fire is completely control.
Oh, gosh.
Unfortunately, at that point, organ damage is widespread.
Oh, wow.
And the chances of survival are very low.
So it's all about catching it early and acting quickly.
You got it.
Okay, so what are the first things someone should do if they suspect someone is in shock?
Okay, so first and foremost, call 911
Okay.
or your local emergency number.
Okay.
Then make sure the person's airway is open and they're breathing.
Okay.
If there's any external bleeding, control it with direct pressure.
Direct pressure.
Absolutely. And keep lying flat to help improve blood flow to the vital organs.
Okay, so call for help, open the airway control bleeding, and lie them flat.
You got it.
Got it. What about IV fluids? Wouldn't that help to like restore blood volume?
So IV fluids are definitely part of the treatment for shock, but it's not as simple as just pumping fluids in.
Okay.
In fact, aggressive fluid resuscitation, especially in cases of hemorrhagic shock,
Okay.
can actually do more harm than good.
Really? I'm surprised to hear that.
Yeah, it can.
Why is that?
So think about what's happening in hemorrhagic shock.
Okay.
Your body is losing blood, and its ability to clot is compromised.
Okay.
If you flood the system with fluids, you can actually dilute the clotting factors,
Oh.
making the bleeding worse.
So it's like trying to put out a fire with gasoline.
That's a really good analogy.
Yeah.
It's a delicate balance.
I see.
The goal is to maintain adequate perfusion without making the bleeding worse.
Right.
That's why the concept of permissive hypotension has emerged.
Permissive hypotension.
Okay.
I've never heard of that.
Have you not?
No, tell me about it.
So it's a strategy where instead of trying to restore blood pressure to like normal levels immediately,
Okay.
doctors allow it to remain slightly lower
Okay.
for a period of time.
But wouldn't that deprive the organs of oxygen?
It's a calculated risk, but studies have shown that in certain cases, this approach can actually improve outcomes
Oh, well.
because it gives the body time to form clots and reduces the risk of dislodging existing clots.
Okay.
Of course, permissive hypotension isn't appropriate for every patient,
Right.
and it requires careful monitoring by medical professionals.
So it's a more nuanced approach than just more fluids is always better.
Exactly. It's about understanding the complexities of the body's response to shock
Yeah.
and tailoring the treatment to the specific situation.
That makes sense. Okay. Now, I know we talked about IV fluids in general.
Yeah.
But are there specific types of fluids that are used in shock?
That's the question.
Thanks.
Solutions like dextrose and water, which are primarily used to provide energy and treat low blood sugar, aren't really effective in shock.
Okay, so what do they use instead?
So the go-to fluids for shock are crystalloids,
Crystalloids.
like normal saline or lactated Ringer solution. They contain electrolytes and help restore fluid balance.
Okay.
In some cases, doctors might also use colloids,
Okay.
which are solutions containing larger molecules that help draw fluid into the stream.
So it's not just about giving fluids, it's about giving the right fluids.
Absolutely. It's all about understanding the nuances of fluid therapy.
Wow. This is all starting to make sense, but I feel like we've only just scratched the surface.
We have,
There's so much more to unpack here.
there is.
Okay, so where do we go from here?
Well, now let's dive deeper into the specific types of shock,
Okay.
starting with the most common one, hypovolemic shock.
All right, I'm ready for the next level.
Let's do it.
Let's do it.
All right.
Okay, so to recap, hypovolemic shock is basically when there's not enough blood circulating in the body.
You got it.
Okay.
Yeah, it's all about a reduction in that circulating blood volume, that vital fluid that keeps our bodies running.
Right, and that can happen for a bunch of reasons, right? Not just bleeding.
That is correct.
Okay, give me some examples.
So while hemorrhage or bleeding is the most common cause,
Okay.
you can also develop hypovolemic shock from severe dehydration,
Okay.
extensive burns, or even severe vomiting and diarrhea.
Wow, so even if you're not visibly losing blood, your body can still react as if you are.
Absolutely. It's all about fluid volume.
Right.
The body needs a certain amount to function.
Okay,
And if that volume drops too low, the heart can't do its job and the organs start to suffer.
that makes sense. Okay, let's start with hemorrhage since that's the most common culprit.
Okay.
What kind of situations are we talking about here?
Well, the usual suspects are traumatic injuries,
Okay.
car accidents, falls, gunshot wounds, stabbings, anything that can damage blood vessels.
Yeah.
But here's the thing.
What's that?
Even a seemingly minor injury can lead to significant blood loss if it involves a major artery.
Okay, that's scary.
Yeah.
Our source material mentioned that injuries to certain organs are particularly dangerous in terms of blood loss.
Yes.
What makes it so different?
So think of it like this. Some organs are like bustling city centers
Yeah.
with tons of blood flow.
Yeah.
The heart, liver, spleen, and major blood vessels are all highly vascular.
Okay,
Damage to any of these can result in massive hemorrhage.
I see.
Yeah.
And what about blunt trauma where there's no visible bleeding?
That's where it gets tricky.
Okay,
Think about like a hard impact to the abdomen. You might not see blood,
right.
but the force can rupture organs like the spleen or liver,
Oh,
leading to internal bleeding. That's really hard to detect.
so it's not just about what you see on the outside and the mechanism of the injury.
Exactly.
Yeah.
You have to consider the bigger picture.
Right.
And look for those subtle signs talked about earlier.
Right. Okay. Let's move on to dehydration. How can someone get so dehydrated that they develop hypovolemic shock?
So dehydration is all about losing body fluids.
Okay.
And it can happen in a surprising number of ways.
Really?
Yeah. The most obvious is not drinking enough,
Okay.
especially in hot weather or during exercise.
Okay.
But you can also get severely dehydrated from illnesses that cause fluid loss,
Oh.
like severe vomiting or diarrhea.
I see.
Your body is essentially being drained of fluids faster than you can replace them.
Okay. And what about burns? How do they fit into the picture?
So think of your skin as a protective barrier holding all those precious fluids in.
Okay.
When you have a severe burn, that barrier is damaged,
Right.
and fluids can leak out at an alarming rate.
Wow.
The larger the burn, the more fluid you lose.
So even though you're not losing blood, still losing vital fluids,
Exactly.
which leads to the same problem, hypovolemic shock.
Precisely. And the consequences are the same too.
Right.
Inadequate tissue perfusion
Right.
and the potential for organ damage.
Okay, so how do we know if someone is developing hypovolemic shock?
Okay, so remember those amazing compensatory mechanisms we discussed?
Yeah.
They come into play here too.
So the body is basically trying to put out the fire, even if it doesn't know what caused it.
Exactly.
Okay.
In the early stage, the body is fighting to maintain blood pressure and perfusion.
Yeah.
One of the first signs you'll notice is a rapid heart rate.
Okay.
Think of it as your heart trying to make up for the lost volume by pumping faster.
Okay.
And breathing becomes faster and shallower as your body tries to get more oxygen into the bloodstream.
It's like trying to take short, quick breaths while running a marathon.
You got it.
And the subtle signs we talked about, like anxiety and restlessness,
Yeah,
are those present in hypovolemic shock as well?
absolutely.
Okay.
The brain is very sensitive to changes in blood flow.
Like-
So if it's not getting enough oxygen, it'll start sending out distress signals.
So if someone's injured or ill and they suddenly become anxious or restless,
Yeah.
that could be a red flag.
It's definitely a warning sign that shouldn't be ignored.
Wow. Okay. So as hypovolemic shock progresses, we see more obvious signs.
Yeah.
Like what kind of signs?
The skin cool and clammy,
Okay.
almost like you're touching a cold, wet cloth.
Okay.
Their lips and nail beds might turn bluish, indicating a lack of oxygen.
Okay. What about blood pressure? Is that a reliable indicator of hypovolemic shock?
Here's the thing.
Okay.
Falling blood pressure is a late sign of hypovolemic shock.
Oh.
By the time you see it, the body's already in serious trouble.
Oh, wow.
So it's not about waiting for the blood pressure to drop. It's about recognizing those earlier signs, like the rapid heart rate and then mental status.
So those are like the early warning system.
Exactly.
Okay, this is incredibly helpful. So let's say recognize those signs.
Okay.
What can be done to treat hypovolemic shock?
It all comes down to two main goals.
Okay.
Addressing the underlying cause
Right.
and restoring adequate perfusion. If the cause is hemorrhage, right, the priority is to control the bleeding.
Okay.
Whether that's applying direct pressure surgery or other interventions.
I see.
And then we talked about fluid replacement.
Nice.
So normal saline or lactated Ringer solution are the fluids of choice.
What are they?
They help to replace those lost fluids and get the blood volume back up.
Okay.
In severe cases, blood transfusions might also be necessary.
Okay.
But remember, it's not just about pumping fluids in.
Right. We talked about.
Exactly. It's about finding that balance between restoring volume and not overwhelming the system.
Okay, so control the bleeding, replace lost fluids carefully, and what else?
And keep the person warm.
Oh, right.
Remember the trauma triad of death?
Yeah.
Hypothermia is a major concern in shock.
Right.
So blankets, warm environments, anything to help maintain body temperature is essential.
Okay, got it. So we've got control the bleeding, replace lost fluids, and keep them warm.
You got it.
3 key ways for treating hypovolemic shock.
You've summarized it perfectly.
Okay, I'm ready to tackle another topic.
All right. What's next on the agenda?
Let's delve into cardiogenic shock.
Excellent. Get ready to learn about the heart's incredible resilience and the challenges it faces when things go wrong.
Ready.
All right.
So to recap, cardiogenic shock is basically when the heart itself can't pump effectively.
Exactly.
Okay.
Imagine your heart is like the engine of your body.
Okay.
In cardiogenic shock, that engine is sputtering and struggling to keep things moving.
Oh no.
Yeah, and this can happen for reasons, right? We talked about heart attacks earlier.
Right.
But what else?
Yeah, what else can cause it?
So heart attack or myocardial infarctions
Right.
are the most common culprits.
Okay.
A blockage in a coronary artery cuts off blood supply to the heart muscle,
Right.
damaging it and weakening its pumping ability.
So it's like a domino effect.
Exactly.
A heart attack weakens the heart, and then the weakened heart can't pump enough blood,
Correct.
leading to shock.
A vicious cycle that needs to be broken quickly.
Oh gosh, okay. But there are other causes too, right?
Yeah, there are.
Like what?
So certain heart conditions like valve problems can put extra strain on the heart.
I see.
What about arrhythmias?
Arrhythmias.
Yeah, those irregular heart rhythms we hear about.
Oh yeah, okay.
Those can disrupt the heart's pumping action too.
How so?
So some arrhythmias cause the heart to beat too fast or too slow,
Okay.
while others mess up the coordination of the heart chambers,
Okay.
making it inefficient at pumping blood.
Okay, so it's not just about a weak heart muscle, it's also about the rhythm and coordination being disrupted.
You got it. Now, believe it or not, even medications can sometimes play a role in cardiogenic shock.
Really? Which ones?
Some medications used to treat high blood pressure,
Okay.
like beta blockers,
Okay.
can sometimes suppress heart function too much,
Oh no.
especially in people with already weakened hearts.
Wow.
It's a delicate balancing act.
So treating one problem can inadvertently contribute to another.
Exactly.
It's tricky.
It is. That's why it's so important to have regular checkups.
Right.
And be open with your doctor about any medications you're taking.
Good advice. Okay, so let's talk about how to spot cardiogenic shock.
Okay.
What are the signs?
Low blood pressure is a big one.
Okay.
The heart isn't pumping with enough force,
Okay.
so the pressure in the system drops.
But we know from our discussion of hypovolemic shock that low blood pressure is a late sign.
That's right.
So what else should we be looking for?
You're catching on quick.
Thanks.
So rapid heart rate is another common sign.
Okay.
The heart is trying to compensate for its weakened pumping ability by beating faster.
Okay.
Think of it like revving the engine to try and get more power.
So a rapid pulse could be a clue that something's wrong with the heart itself.
It's definitely a possibility, especially if it's accompanied by other symptoms.
Okay.
And just like with hypovolemic shock, rapid breathing is common as the body tries to get more oxygen.
Makes sense. What about shortness of breath?
That's another one to watch for.
Okay.
Especially if it's worse when lying down. The weakened heart struggles to pump blood out of the lungs efficiently.
I see.
So fluid can build up,
Okay.
making it hard to breathe.
So it's not just the heart that's affected, it's the lungs too.
Exactly. Cardiogenic shock can have a ripple effect throughout the body.
Wow. Okay. And like with the other types of shock, you might also see changes in mental status.
Absolutely.
Okay.
Like confusion, disorientation, or agitation.
Okay. So it's the brain saying, hey, I'm not getting enough oxygen here.
Exactly.
Okay. So we've got low blood pressure, rapid heart rate, rapid breathing, shortness of breath, and altered mental status.
Right.
Are there any other signs that are specific to cardiogenic shock?
There are a couple of key signs
Okay.
that can really help distinguish it.
Okay.
One is the presence of crackles in the lungs.
Crackles.
Yeah, have you ever heard of that?
No, what are those?
They're abnormal lungs
Oops.
that doctors can hear with a stethoscope.
Yeah.
Sounds like crackling or bubbling.
Okay.
And it indicates fluid buildup in the lungs.
Right, because the weakened heart can't pump blood out of the lungs efficiently.
Exactly.
So it's like a trap jam in the lungs.
Perfect analogy.
Okay, I like that.
And this fluid buildup makes it even harder to breathe.
Right, so crackles in the lungs is one telltale sign.
Okay.
And the other one is
Jugular vein distension.
jugular vein distension, or JVD.
Exactly.
Okay, break it down for me.
So think of it this way. The jugular veins in your neck are like pipelines carrying blood back to the heart.
Oh, wow.
In cardiogenic shock, the right side of the heart can become overloaded
Okay,
because the left side isn't pumping effectively.
I see.
This causes blood to back up in the jugular veins, making them appear swollen.
So it's like a backup in the plumbing system.
Exactly. And this backup can extend all the way back to those jugular veins,
Nice.
making them visibly distended.
Okay, so we've got crackles in the lung and jugular vein distension as two telltale signs of cardiogenic shock.
You got it.
This is starting to feel like detective work.
It is.
Yeah,
Each sign and symptom is a clue.
right. And it's all about putting them together to solve the puzzle.
Love that analogy. Okay, so we've got a handle on the signs and symptoms. Now, how do we treat cardiogenic shock?
Okay, so treating cardiogenic shock requires a multi-pronged approach,
Okay.
addressing the underlying heart problem,
Oh.
improving heart function, and supporting the body's vital organs.
Sounds intense.
It can,
Where do we even begin?
just like with any type of shock, the first priority is making sure the person's airway is open
Okay,
and they're breathing properly.
makes sense.
Supplemental oxygen is usually provided to help boost those oxygen levels in the blood.
Okay, so oxygen therapy, and then I'm guessing medications also play a big role.
Absolutely. Medications are the workhorses of cardiogenic shock treatment.
Okay,
The specific ones used depend on the underlying cause and how severe the condition is.
okay.
But there are a few common types.
Like what? What kind of medications?
So one type is called inotropic agents.
Inotropes. Yeah, they help to increase the force of the heart's contractions,
Okay.
making it pump more effectively. Think of them as giving the heart a little extra muscle.
So like a booster shot for the heart.
Basically,
Okay.
they give it that extra oomph to pump blood more efficiently.
Makes sense.
Another type is vasopressors,
Okay.
which constrict blood vessels, raising blood pressure and improving blood flow to the vital organs.
So it's like tightening the hose to increase the pressure.
You got it.
I like these analogies.
And depending on the underlying cause, doctors might also use medications to break up blood clots
Okay.
or adjust dosage of medications that might be contributing to the shock, like those beta blockers we talked about earlier.
So it's about finding the right balance of medications to support the heart without suppressing it too much.
Exactly. It's a delicate dance, and it requires careful monitoring and adjustments.
Okay, so we've got oxygen therapy and medications.
Right.
What else is in the cardiogenic shock toolkit?
There are a few other interventions that might come into play.
Okay, like what?
One is mechanical ventilation.
Mechanical ventilation.
Yeah.
Okay, I remember that from our deep dive on respiratory distress.
You do.
Yeah, that's when a machine person breathes right.
That's right. In cardiogenic shock, the lungs can get overloaded with fluid,
Right.
making it difficult to breathe on their own.
Yep.
Mechanical ventilation helps to support breathing and improve oxygenation.
Not just about the heart, it's about giving the lungs a break too.
Exactly. Remember, cardiogenic shock affects multiple organ systems.
Right. Okay.
Another intervention you might hear about is an intra-aortic balloon pump, or IABP.
Okay, an IABP? That one sounds. What in the world is an IABP?
So it's a device that's inserted into the aorta, the main artery leaving heart.
Okay.
The IABP inflates and deflates in sync with the heartbeat,
Okay.
helping to improve blood flow to coronary arteries and reduce the workload on the heart.
So it's like a little helper for the heart.
You could say that.
Okay.
It's a temporary measure to support the heart while it recovers.
Wow, this is all fascinating, but it sounds really.
It definitely is.
Yeah.
Cardiogenic shock is a serious condition that requires specialized care.
Right.
But even having a basic understanding can be helpful, especially if you or a loved one is dealing with it.
Yeah, I agree. Okay, so let's recap.
Right?
Treating cardiogenic shock involves supporting breathing,
Right.
administering medications to improve heart function and raise blood pressure, and possibly using mechanical ventilation or an IABP.
You got it.
And of course, treating the underlying cause like a heart attack is essential.
You're really getting the hang of this.
I'm starting to feel like a shock expert.
Don't jump ship to medical school just yet.
Okay,
But it is empowering to understand these conditions, isn't it?
it really is.
Yeah.
Okay, I'm ready for the next challenge.
Okay, you are.
What other types of shock should we explore?
Let's talk about neurogenic shock.
Neurogenic shock.
This one really shows the connection between your nervous system and your cardiovascular system.
Yeah.
It's usually caused by spinal injuries, and it can be tricky to recognize.
Okay, I'm intrigued. Let's dive into neurogenic shock.
All right, get ready for a fascinating journey into the world of nerves and blood vessels.
So remind me again, what exactly is neurogenic shock?
It's all about a disruption in the nervous system's control over blood vessel constriction.
Okay, back up a second. How does our nervous system blood vessels?
Okay, so think of your nervous system as a vast communication network,
Okay,
sending signals throughout your body.
hang on.
It can send signals to the muscles in your blood vessel walls, telling to constrict or relax.
So that's how our bodies like adapt to changes in position or activity level.
Yeah, or even temperature.
Oh,
exactly. It's a constant balancing act.
Right.
And then is the conductor.
I like that.
But in neurogenic shock, the conductor gets knocked out of commission, disrupting the whole orchestra.
And the most common reason for this is a spinal cord injury.
You got it. When this is injured, those signals from the brain to the blood vessels can get interrupted or scrambled.
Oh, no.
Yeah, and this can lead to widespread vasodilation.
Vasodilation.
Basically, the blood relax and widen too much.
And why is that a problem?
Think of it like expanding a water balloon without adding water.
Okay.
The pressure inside drops, right?
Right.
The same thing happens in your circulatory system.
Right.
The blood vessels get too big for the amount of blood they contain, and the blood pressure drops.
Even though the person isn't actually losing blood, it's like their body is reacting as if they are because of this vasodilation.
You're absolutely right. It's called relative hypovolemia.
Relative hypovolemia. Okay, so what makes neurogenic shock tricky to recognize?
So what makes it tricky is that it doesn't like the other types of shock.
Okay, in what way?
Well, you might not see the typical compensatory mechanisms, like a rapid heart rate and cool, clammy skin.
Okay.
In fact, the heart rate might act slower than normal, and the skin might be warm and dry.
That seems kind of counterintuitive.
It is.
Why wouldn't the body try to compensate by like increasing the heart rate and vessels?
It's because the problem isn't with the heart or blood volume directly.
Yeah.
It's with the nervous system's ability to regulate those things.
I see.
The signals just aren't getting through.
Wow.
So the body's in a state of vasodilation.
Yeah.
And those classic compensatory mechanisms don't kick in as you expect.
So it's almost like the body's emergency response team is out of touch.
That's a great way to put it.
Yeah.
And this can make neurogenic shock harder to recognize, especially in the early stages.
Okay, so with slow heart rate and warm, dry skin,
Yeah.
what other signs and symptoms should we be looking for?
So low blood pressure is still a hallmark sign,
Okay.
along with dizziness, lightheadedness, and weakness.
Okay, and what about mental status? Is that affected in neurogenic shock?
Absolutely.
Right.
You might see anything from mild confusion to a complete loss of consciousness. Remember, the brain needs a constant supply of oxygen-rich blood.
Right.
And when that supply is compromised, things start to go haywire.
So even though that might be slow, the other signs and symptoms still indicate that something is seriously wrong.
Exactly. It's crucial not to be fooled by that slow heart rate.
Right. It's not a sign that everything's okay.
Not at all.
Okay, so we've got a handle on the signs and symptoms. Now, how do we treat
Okay.
Is it similar to the other types of shock?
There are some similarities, but there are also some important differences.
Okay, tell me more.
So the first priority, if there's a spinal cord injury,
Okay.
is to stabilize the spine
Okay.
to prevent further damage.
So we're talking about like immobilizing the person with a backboard.
Exactly.
Okay.
You want to keep that spine as still as possible to minimize the risk of further injury.
Got it.
Next, you focus on supporting breathing and circulation.
Okay.
Oxygen is typically provided, and if the blood pressure is dangerously low, IV fluids might be given.
Okay, boost the blood volume.
Exactly.
But we talked earlier about how aggressive fluid resuscitation can be harmful in some cases.
Right.
Does that apply to neurogenic shock too?
It's a bit more nuanced here. While fluids aren't ideal,
Okay.
they can be helpful in the short term to support blood pressure.
Yeah.
The key is to use fluids judiciously
Okay.
and monitor the person's response carefully.
So stabilizing the spine, supporting breathing and circulation.
Right.
What about treating the spinal cord itself?
So treating spinal cord injuries is a whole other deep dive.
Yeah, that.
But it often involves a combination of surgery medications and rehabilitation.
Okay.
Surgery might be needed to relieve pressure on the spinal cord,
Okay.
or to stabilize the spine. Medications can help to reduce swelling.
Okay. And what about rehabilitation?
Rehabilitation plays a crucial role in helping people regain function and adapt to life after a spinal cord injury. This can involve physical therapy, occupational therapy, and other therapies tailored to their individual needs.
So it's a long road to recovery.
It can be. Spinal cord injuries are complex,
Right.
but with the right care and support,
Yeah.
significant progress.
That's good to hear. Okay, so that's neurogenic shock in a nutshell.
Yes,
I'm starting to see all these different types of shock are interconnected,
they are.
but yet each has its own unique challenges.
Exactly.
Are we ready to tackle another type of shock?
You bet. Let's move on to anaphylactic shock.
Anaphylactic shock.
The severe allergic reaction that can quickly become life-threatening.
Okay, I'm all ears. Bring on the anaphylaxis.
Anaphylactic shock is essentially your body's immune system going into overdrive.
Okay.
It's like a security system that mistakes a harmless visitor for a dangerous intruder
Oh,
and sets off all the alarms.
and we've talked about how the body reacts to stress.
Right.
But this is like a level of reaction.
Absolutely. It's an extreme response to an allergen.
Right.
Something that normally wouldn't cause a problem,
Okay.
but in anaphylactic shock,
Yeah.
it triggers a cascade of events that can be life-threatening.
So what kind of things can trigger this extreme reaction?
Lots of things.
Give me some examples.
Foods, medications, insect stings,
Okay.
even latex.
Okay.
But some of the most common culprits are peanuts, tree nuts, shellfish, milk eggs, soy, and wheat.
For food allergy.
Exactly.
Okay, and what about medications? What can cause this?
Penicillin and other antibiotics,
Okay.
aspirin, and NSAIDs.
Okay.
And certain chemotherapy drugs are all known to trigger anaphylactic shock in some people.
Okay, and for insect sins, we're talking about bees, wasps. hornets, that kind of thing.
Exactly.
Okay, so it's important to know your own allergies
Yeah.
and avoid contact with those triggers.
Absolutely.
But even if you're careful, accidents happen.
Right.
So it's crucial to recognize the signs of anaphylaxis early.
Yes.
And know how to respond. Okay, so let's talk about those signs. What should we be looking for?
So anaphylaxis come on quickly, within minutes or hours of exposure to the allergen, and the symptoms can vary, but some common ones include skin reactions, like hives and itching.
So it's not just a little rash, it's more like a full-body allergic eruption.
That's a good way to put it. You might also see swelling of the face, lips, and tongue.
Okay.
Which can be really scary.
Yeah.
You'll wheezing or see the person struggling to breathe.
Right, because those airways are constricting.
Exactly.
And of course, there's a blood pressure, just like with the other types of shock.
That's right. That's a hallmark of shock, regardless of the cause.
Okay, this all sounds pretty serious. What should someone do if they suspect shock?
First and foremost, call 911.
Okay.
This is a true medical emergency. Every second counts.
And while you're waiting for help to arrive?
If the person has an epinephrine auto-injector, like an EpiPen, use it immediately.
Okay, I remember we touched on epinephrine earlier.
Yeah.
It's that fight or flight.
Yeah.
But how does it help in anaphylaxis?
Epinephrine is a powerful medication that counteracts the effects of anaphylaxis.
Okay.
It constricts blood vessels to raise blood pressure.
Okay.
Opens up the airways to improve breathing.
Okay.
And basically tells the immune system to chill out.
So it's like the reset button on the allergic reaction?
Exactly. It can buy precious time while you wait for emergency responders.
That's awesome. Okay.
Yeah.
Call 911, administer epinephrine if available.
Yes.
What else?
Help the person lie down and elevate their legs if possible.
Okay.
This can help improve blood flow to the vital organs.
Okay.
Also loosen any tight clothing and try to keep them calm and reassured.
Okay. Those are like simple but important steps.
They are.
So to recap,
Okay.
call 911,
Right.
use an EpiPen if you have one,
Yes.
and provide basic first aid for help to arrive.
You've got it. And remember, even if the person seems to recover after using an EpiPen, it's still crucial to seek medical attention.
Oh, really? Why is that? I would think it would take care of the problem.
So anaphylaxis can be sneaky.
Okay.
Sometimes symptoms return hours after the initial reaction.
Wow.
It's called a biphasic reaction.
Okay.
And it's important to be monitored by medical professionals to ensure the reaction is truly resolved.
So it's like the fire seems to be out, but there's still embers smoldering beneath the surface.
That's a great analogy. Now we've covered 3 major types of shock: hypovolemic, cardiogenic, and anaphylactic shock.
Right.
Are you ready for the grand finale?
Bring it on. What other shock secrets are you going to reveal?
Let's dive into septic shock.
Septic shock.
Yeah, the one that occurs when the body's response to an infection goes haywire.
Septic shock. That's one I've heard of, but I don't really understand what makes it different from just a regular infection.
It's more than just a bad infection. A life-threatening condition where the body's own immune system turns against it.
So it's like the body's defense system goes rogue.
Exactly. Think of it as a wildfire spreading throughout the body. Damage wherever it goes.
That sounds terrifying.
It can be.
So how does this happen? What causes septic shock?
It all starts with an infection.
Okay.
But not just a minor one.
Okay.
It's a severe infection that gets into the bloodstream.
Okay.
Like a bacterial, fungal, or even viral infection gone wild.
So does that mean any infection has the potential to turn into septic shock?
Necessarily.
Okay.
While any infection can potentially lead to sepsis,
Okay.
the risk is with certain types.
Okay, like what?
Pneumonia,
Okay.
urinary tract infections,
Okay.
and skin infections are some of the usual suspects.
Okay. And what about people with weakened immune?
Yes,
Are they more vulnerable?
absolutely.
Okay.
Their immune systems are already struggling. So they're more susceptible to developing septic shock if an infection takes hold.
Okay, so let's break this down. The infection triggers this massive inflammatory response
Yes.
that damages the body's tissues and organs.
Right.
But how does that actually happen?
Okay. So when your body has an infection,
Okay.
it releases chemicals to fight it off.
Okay.
These chemicals called cytokines trigger inflammation,
Okay.
which is usually a good thing.
Right.
It's part of the healing process.
Right.
But in septic shock, the inflammation goes overboard.
Oh.
Like a fire hose that's lost control.
Instead of helping, the inflammation actually starts to harm the body.
Exactly.
Huh.
The excessive inflammation damages the lining of your blood vessels,
Okay.
making them leaky.
Oh.
Fluid leaks out of the bloodstream into the surrounding tissues,
Oh, no.
and boom, you've got a drop in blood pressure.
So we're back to that relative hypovolemia,
That's right.
even though there's no actual blood loss.
Exactly. The blood vessels are too wide and leaky, so the effective blood volume decreases,
Okay.
and it doesn't stop there.
Oh no, what else happens?
This uncontrolled inflammation can also disrupt blood clotting.
Oh, the domino effect.
I know it's bad. What happens when blood clotting goes haywire?
You can develop something called disseminated intravascular coagulation, or DIC for short.
DIC. Okay, that doesn't sound good at all. What exactly is going on there?
It's basically your clotting system going into overdrive.
Okay.
Tiny blood clots form throughout your bloodstream,
No.
blocking blood flow to vital organs and causing damage.
So it's like the body's clotting system is attacking itself.
It's a bit like that, a paradoxical situation where the body is both clotting too much and bleeding too much at the same time.
Wow. Okay, we've got leaky blood vessels,
Right.
low blood pressure, DIC. Anything else we need to add to this septic shock story?
Unfortunately, yes.
Oh gosh. Okay, what else?
The inflammation can damage organs directly,
Oh.
leading to multiple organ dysfunction syndrome, or MODS. MODs. Okay, I'm starting to see a pattern here, all these scary acronyms. What's MODS all about?
It's a serious condition where multiple organs start to fail.
Okay.
This happens when the organs are deprived of oxygen and nutrients,
Right.
low blood pressure, and the poor blood flow.
Okay.
And the inflammation itself can also directly damage those organs.
Wow, septic shock sounds incredibly dangerous.
It is. It's one of the leading causes of death in intensive care units worldwide.
Okay. I'm getting chills just thinking about it.
I know, it's scary stuff.
Yeah. So,
Yeah.
how do you even begin to recognize septic shock? What are the warning signs?
It can be tricky in the early stages
Okay.
because the symptoms can be subtle
Okay.
and mimic other conditions. But some common signs include fever,
Okay.
chills, a rapid heart rate, rapid breathing,
Okay.
low blood pressure, and altered mental status.
Okay. Those sound a lot like the signs of other types of shock.
They do.
So, how do you know it's septic shock?
The biggest clue is the presence of an infection. If someone has a known infection like pneumonia or a UTI,
Okay.
and they start showing signs of shock, septic shock is a major concern.
So, if they already have an infection
Yes,
and then they start showing the signs.
exactly.
Okay. And what about the skin? We talked about how skin appearance can vary depending on the type of shock.
Right.
What's the pattern with septic shock?
So in the early stages, the skin might be warm and flushed
Okay.
because of the widespread vasodilation.
Okay.
But as it progresses, the skin can become cool and mottled as blood flow decreases.
So, they provide clues, but it's not always a reliable indicator on its own.
Exactly.
Okay.
It's all about looking at the big picture, all the signs and symptoms together.
Okay, so we've got a handle on the signs and symptoms.
Okay?
Now, how do you tackle this beast? Is treating septic shock as complex as treating cardiogenic shock?
You bet it is. It's
Okay.
a three-pronged attack.
Okay.
Identifying and treating the infection,
Okay.
supporting vital organs, and managing the inflammatory response.
Okay, step one, tackling the infection. How do you even know what kind of infection you're dealing with?
So doctors usually start with blood cultures
Okay.
to figure out what bacteria is causing the infection.
Okay.
And they'll often start broad spectrum antibiotics
Okay.
that cover a wide range of possible culprits.
So it's like throwing a wide net to catch the infectious bad guys.
That's a great way to put it.
Yeah.
And once they get the blood culture results back, they can tailor antibiotics to specifically target the bacteria causing the infection.
Okay, so antibiotics are crucial.
They are.
What about supporting the vital organs? Is that similar to what we talked about for the other types of shock?
There are definitely some similarities.
Okay.
Oxygen therapy,
Yeah.
IV fluids,
Okay,
and medications to support blood pressure and heart function are all part of the game plan.
so we're back at delicate balancing act of fluid management.
Exactly.
Right.
But in septic shock, managing the inflammatory response is also paramount.
Right, so how do you do that?
Okay.
It's not like you can just tell the inflammation to come.
No, you can't, unfortunately.
Right.
But there are medications that can help modulate the immune system
Okay.
and reduce inflammation.
Okay.
Corticosteroids, for example, can help dampen down that excessive inflammatory response.
So it's like putting out the wildfire that's raging through the body.
That's the idea.
Okay.
You want to control the inflammation and prevent further damage.
Okay, so antibiotics, supportive care, and inflammation management.
Right.
Those are the key pillars of septic shock treatment.
You've summed it up perfectly. Septic shock is a serious condition, but with prompt and aggressive treatment, many people can recover.
That's good to hear. Okay, so we've covered 4 major types of shock:
Yes,
cardiogenic, anaphylactic, and septic shock.
we did it.
My head is spinning with all this information.
I know it's a lot to take in,
It is.
but it's all about connecting the dots.
Right.
And using job of following along and asking great questions.
Oh, well, thank you. I feel like I could teach a class on shock.
Well, maybe not yet.
Okay.
But you definitely gain a solid understanding of these complex conditions.
I think so too.
Yeah.
And that's what it's all about, right?
That's what it's all about.
Empowering yourself with knowledge so you can recognize and potentially save a life.
Exactly.
This has been an incredible deep dive. I feel like I've learned so much about how my body reacts in emergencies.
And remember, we've just scratched the surface.
Yeah,
The human body is full of surprises.
it is.
But the more we understand about how it works,
Yeah,
the better equipped we are to handle whatever life throws our way.
I agree. So for our listeners out there, what are the key takeaways you want them to remember?
So be aware of the signs and symptoms of bleeding and shock, both internal and external.
Okay.
Don't hesitate to seek help if something seems off, especially with children.
And even if you're not a medical professional,
Mm-hmm.
there are things you can do to help while waiting for help to arrive.
Absolutely. Simple things like controlling and bleeding with direct pressure
Right.
and keeping someone warm can make a world of difference.
Great advice. This deep dive has truly been an eye-opener.
It has.
So for everyone listening out there, thanks for joining us on this deep dive into bleeding and shock.
It's been a pleasure.
We'll be back next time with another fascinating topic to explore. Until then, stay curious, stay informed, and stay safe. Okay, so we've explored all these different ways our bodies can go into shock,
We have.
but we haven't really talked about how our bodies try to fight back.
Yeah, it's true.
Can't all be bad news, right?
Of course not. The human body is incredibly resilient.
Okay, good.
It has all these amazing built-in mechanisms
Okay.
to try and maintain stability
Okay.
and protect those vital organs when shock sets in.
So it's not just giving up.
Oh, no, not at all.
It's trying to do something.
Think of it like a well-coordinated emergency response team springing into action.
Okay, I like that analogy. So,
Yeah.
so what's the first line of defense?
One of the key players is what we call the autonomic nervous system.
Yeah.
Remember, it's the part of our nervous system that we consciously control.
Okay, so things like breathing.
Yeah, things like breathing, heart rate, and digestion.
Right, and it has two branches. The sympathetic nervous system, which is all about fight or flight,
Yes.
and the parasympathetic nervous system, which is more about rest and digest.
You got it. And in shock, it's the sympathetic nervous system that takes charge.
Fight or
It's
flight.
like a super swooping in to save the day.
Okay, I'm picturing a superhero in a cape. So what does this superhero actually do?
It releases a surge of adrenaline and noradrenaline,
Adrenaline.
also known as epinephrine and norepinephrine.
Right, okay.
These hormones are like messengers racing through the bloodstream
Okay.
and delivering urgent instructions to different parts of the body.
So it's like sending out a bat signal to call for backup.
Exactly. The message out and clear, we're in trouble, take action.
Okay, I love it. So what happens first? What's the first thing that gets that message?
One of the first targets is the heart.
The heart, okay.
These heart beat faster and stronger.
To try and like pump more blood?
Exactly.
Okay.
To compensate for what's causing the shock.
Right, to get more blood to the vital organs.
Precisely. It's like trying to keep the water flowing through a leaky hose
Okay.
by increasing the pressure.
And the sympathetic nervous system also those leaky blood vessels, right?
It does.
How so?
It causes the blood vessels in the skin muscles and digestive system to constrict,
Okay.
narrowing them to help redirect blood flow to the vital organs,
Oh, okay.
the brain, heart, and lungs.
So it's like prioritizing traffic flow.
Yes.
Making sure the most important vehicles get through the congestion.
You're getting it.
Okay.
The body is basically saying, we can sacrifice blood flow to the less essential areas
Okay.
to make sure the brain and heart stay online.
Our bodies are so smart.
I know, they're amazing.
What else does this superhero nervous system do?
It also triggers the release of hormones that help the body conserve fluid.
Okay.
For example, aldosterone tells the kidneys to reduce the amount of sodium and water in urine.
Okay, to hold on to those fluids.
Exactly.
Uh-huh.
It's like plugging those leaks and holding onto every precious drop of fluid.
Okay, so it's a brilliant strategy,
It is.
but it's not a permanent solution.
Unfortunately not.
What do you mean?
These compensatory mechanisms are like temporary fixes.
Okay.
They can buy the body some time.
Right.
But if the underlying cause of shock isn't addressed, they will eventually fail.
So it's like running on a backup generator.
Yeah,
You can keep the lights on for a while. Actually, you need to fix the main power source.
that's a perfect analogy. And that's why getting medical attention as quickly as possible is so crucial.